This video is Stage 2, Meaningful Use with MyVision Express 2014. Meaningful use is best defined as demonstrating the use of a certified EHR in ways that can be measured as being used in a meaningful way. This includes using e-Prescribe, using EHR technology for electronic exchange of health information, and to submit clinical quality and other measures. Meaningful Use Stage 2 contains 23 measures. There are 17 core measures and 6 menu measures. 6 require a yes or a no, and 17 require a numerator and a denominator. In addition, you must attest to 9 clinical quality measures. 3 must be of the 6 available national quality strategy domains. In the first year, the reporting period is 90 days minimum. Subsequent years is the entire year. Starting in 2015, regardless of which stage you are in, you will be doing the entire year. So 2014 is the last year to do a 90-day reporting period. 2014 also has a special meaningful use reporting period length for all non-first-time EPs, EHs, and CAHs. As a result, no EPs, EHs, or CAHs that previously demonstrated meaningful use before 2014 has to start meaningful use at the beginning of the federal fiscal year, which is October 1st, 2013, or calendar year, which is January 1st, 2014. The 2014 Meaningful Use Reporting Period for both Stage 1 and 2 performance is set to 1 calendar quarter during a Medicare EP, EH, and CAH's reporting year. So a quarter would be April 1st through June 30th, 2014, and that would be a Medicare EP second quarter, and it would be an EH or a CAH's third quarter. All Medicaid EPs, EAHs, and CAHs, as determined by their state, will have any continuous 90-day or 3-month reporting period during 2014. Last, all new EPs, EHs, and CAHs will continue to have any continuous 90-day reporting period. Now, as far as the incentives and the penalties, the incentive is 75% of Medicare Part B. The penalties are 1 to 3% from 2015 to 2017 and 3 to 5% in 2018 to 2019. Now also keep in mind that 2014 is the last year that doctors can start meaningful use to receive the incentive. So it doesn't mean that starting in 2015 no one's getting an incentive. It just means that in 2014 it's the last year to start meaningful use so you can receive an incentive. So you'll still receive an incentive throughout the years. There are no penalties for Medicaid providers. Incentive payments are a fixed amount each year and remain constant as long as you meet all of the eligibility requirements for the program participation. Now, who is eligible? Medicare, doctors of optometry; Medicaid, physicians, primary doctor of medicine; and 5 states now offer Medicaid EHR incentives to doctors of optometry. Those 5 states are Alabama, Illinois, Kentucky, Ohio, and South Carolina. Now, to sign up, you do have a Medicare Medicaid registration and attestation system, which is done through cms.gov. For Stage 2, though I'm sure that everyone has already signed up, you will need an individual NPI number and user account with a national plan and provider enumeration system, web user account, and you must also enroll with PICOS. Now, going into Stage 2, many of the objectives in Stage 2 will be familiar to you from Stage 1. Some objectives that were in the menu set in Stage 1 have been moved to the core set for Stage 2 and are now required for all providers. Some objectives that were in the core set in Stage 1 now have higher threshold that you must achieve in order to successfully demonstrate meaningful use of your EHR in Stage 2. There are also some new Stage 2 core and menu objectives. So let's start with the 17 core, and then we'll go into the 6 available menu objectives. We'll start with core objective number 1, CPOE for medication orders. The objective is to use computerized provider order entry for medication laboratory, radiology orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state, local, and professional guidelines. The measure is more than 60% of medication, 30% of laboratory, and 30% of radiology orders created by the EP during the EHR reporting period are recorded using CPOE. The exclusion is any EP who writes fewer than 100 medication, radiology, or laboratory orders during the EHR reporting period. In order to comply using MyVision Express, you're going to open up the RX pad in the Medication subtab of the Health tab. The Health tab is found in the Patient Profile and then of course also the Exam. I have a medication that's opened right now, and in order to comply, you are actually going to change the status to ordered, and the type is going to be medication order. Core objective number 2 is e-Prescribe. The objective is to generate and transmit permissible prescriptions electronically. The measure is more than 50% of all permissible prescriptions or all prescriptions written by the EP are queried for a drug formulary and transmitted electronically using CEHRT. There are 2 available exclusions for this measurement. The exclusion is any EP who writes fewer than 100 permissible prescriptions during the EHR reporting period, and the other exclusion is any EP who does not have a pharmacy within their organization, and there are no pharmacies that accept electronic prescriptions within 10 miles of the EP's practice location at the start of his or her EHR reporting period. Going back into the Medication subtab of the Health tab, you have 2 available e-Prescribe buttons. One is found on the side on the actual tab. The other one is when you open up the RX pad. When you click on e-Prescribe, and if you are signed up with the vendor that we use, Doctor First, it will take you to Doctor First. From there, you can write the prescriptions, you can print them out, and you can also submit it electronically to the patient's pharmacy. Doctor First does have drug formularies within their system, so it will do those drug formulary checks for you. Core number 3 is record demographics. The objective is to record all of the following demographic information: preferred language, sex, race, ethnicity, and date of birth. The measure is more than 80% of all unique patients seen by the EP have demographics recorded as structured data. There is no exclusion to this objective. To comply using MyVision Express, you're going to go into the patient profile. It is found on the top of the toolbar here. It's the second one. And when you're entering information, you have the available fields. So you have date of birth, you have sex, you have ethnicity, race, and you also have preferred language. Now you'll notice also with ethnicity and with race, there is an added category here, decline to specify. You'll also notice that if I erase some of the fields here, there are sections in the seafoam green color. Once again, this is indicating that it is related to meaningful use, so it's a friendly reminder to add some information in here to count towards meaningful use. Core number 4 is record vital signs. The objective is to record and chart changes in the following vital signs: height, length, and weight with no age limit, blood pressure, ages 3 and over, calculate and display body mass index, and plot and display growth charts for patients 0 to 20 years, including BMI. The measure is more than 80% of all unique patients seen by the EP have blood pressure for patients age 3 and over only, and or height and weight for all ages recorded as structured data. There are several exclusions for this objective. The first one is any EP who sees no patients 3 years or older is excluded from recording blood pressure. The second one is any EP who believes that all 3 vital signs of height, length, weight, and blood pressure have no relevance to their scope of practice is excluded from recording them. The third exclusion is any EP who believes that height, length, and weight are relevant to their scope of practice, but blood pressure is not, is excluded from recording blood pressure. And the fourth one is any EP who believes that blood pressure is relevant to their scope of practice, but height, length, and weight are not, is excluded from recording height, length, and weight. You're going to go to the Vitals subtab of the Health tab. I've already added a line here, so you'll notice that there are those fields in seafoam green once again. So you have a section here for systolic, diastolic, height, weight. You can also enter the measure type. You'll notice also that we do have a growth chart available, and BMI is automatically calculated for you. Core number 5 is record smoking status. The objective is to record smoking status for patients 13 years or older. The measure is more than 80% of all unique patients 13 years or older seen by the EP have smoking status recorded as structured data. The exclusion is any EP that neither sees nor omits any patients 13 years or older. There are 2 ways that you can enter smoking status for the patient. You have a section here, smoking status, in the patient profile. You also have a smoking status under the PFSH, or the Past Family Social History subtab of the Health tab. Now this tab is actually not shared in the patient profile as well, so this tab is actually specific to the exam. Within the tab, you'll notice that there is the smoking status. Now also keep in mind that anything you enter in the patient profile for smoking status will show up in this tab as well. Core number 6 is clinical decision support rule. The objective is to use clinical decision support to improve performance on high priority health conditions. Now this objective actually has 2 measurements. The first measurement is to implement 5 clinical decision support interventions related to 4 or more clinical quality measures at a relevant point in practice care for the entire EHR reporting period. Absent 4 clinical quality measures related to an EP scope of practice or patient population, the clinical decision support interventions must be related to high priority health conditions. Measure 2 is the EP has enabled and implemented the functionality for drug-drug and drug allergy interaction checks for the entire EHR reporting period. There is an exclusion that applies to this objective, and it only applies for the second measure. Now for the second measure, any EP who writes fewer than 100 medication orders during the EHR reporting period is excluded. So for anyone who gets confused about the 100 medication orders, just consider it any medications that you have written. Now to comply with the first measure, you're going to go to File, you're going to go to Setup, Exam, and Alerts. You're going to click on Add, and it'll open up a window here for you. You're going to add a description. Now remember that they do want 5 clinical decision support rules, so you're going to create 5 separate ones. I'm going to use an example here just to show you how to create at least one. My description is going to be glaucoma. I'm going to say bring back in 3 months for more tests. Actually, you can also choose an age range. I'll just do anyone over 40. I'll do an ethnicity. So I'll do non-Hispanic, Latino, and then I'll do Black or African American. Now you can set security groups here as well, so you can show, so you can select which groups you'd like this to show up for. Then you're going to click on Details. Now you'll notice that it's going to have several subtabs here, so you can tie in this alert either by medication, an allergy to anything, or more specifically a problem. So I'm going to add a problem to this. Since my description is glaucoma, I'm going to start to type in glaucoma. So anytime that I add this in my examination, this alert, bring back in 3 months for OCT, will appear. And I'm just going to click Close. And I'll save. So you do have to do 4 more of these, in total 5, in order to comply with it. You also want to make sure that these are related to clinical quality measures. So I know that some measures have, glaucoma, they have blood pressure, they have height and weight. They also have diabetes, eye exam, or diabetic retinopathy. So those are some good ones to implement for clinical decision support. Now, in order to comply with the second measure, if you have e-Prescribe the vendor that we use is Dr. First. They do have drug-drug and drug allergy interaction checks that are enabled within the system. Now, you have to make sure that from the beginning to the very end of the reporting period, you have this functionality enabled, meaning you have e-Prescribe. Core number 7 is patient electronic access. The objective is to provide patients the ability to view online, download, and transmit their health information within 4 business days of the information being available to the EP. This is also another objective that is broken down into 2 measurements. Measure number 1 is more than 50% of all unique patients seen by the EP during the EHR reporting period are provided timely, available to the patient within 4 business days after the information is available to the EP, online access to their health information. The second measure is more than 5% of all unique patients seen by the EP during the EHR reporting period or their authorized representatives view, download, or transmit to a third party their health information. There are 2 exclusions available for this objective. The first one is any EP who neither orders nor creates any of the information listed for inclusion as part of both measures except for patient name and provider's name and office contact information may exclude both measures. The second one is any EP who conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 3 Mbps broadband availability according to the latest information available from the FCC on the first day of the EHR reporting period may exclude only the second measure. To comply using MyVision Express, you're going to go into either the patient profile or the exam screen. And you're going to go to the HL7 CCD CCR subtab of the Health tab. I've already created a clinical summary, so you're going to click on this button, and just to kind of repeat the steps, you're going to see all the information. So problems, medication, allergy, lab tests and results, vital signs, a care plan, procedures, clinical instructions, diagnostic testing plan, future appointments, scheduled tests, immunizations, chief complaint, education, referral to provider, and then you'll just generate it and it'll create a new one. And this is what the clinical summary will look like. So after that's been created, you're going to click on Upload. Now Upload is going to send it to their patient portal. Now don't think patient portal like the ones that web hosted customers use. This is actually a separate portal that was introduced with 2014. This portal is strictly for meaningful use, so it will not contain the same kind of information in the regular patient profile, in the regular patient portal that our web hosted customers use for patients to request appointments, also fill out patient history forms. Now for the second measure, the patient's actually going to log into their patient portal. So the patient's going to log into their patient portal, and the patient's going to see a tab on the top that says HL7 CDA. So they're going to click on that. They'll be able to search for their CDAs, and then once they open up that CDA, it will trigger the numerator in the reports. Core number 8 is clinical summaries. The objective is to provide clinical summaries for patients for each office visit. The measure is clinical summaries provided to patients or patient-authorized representatives within 1 business days for more than 50% of office visits. The exclusion is any EPs who have no office visits during the EHR reporting period. This exclusion actually will not apply to any of our MyVision Express customers because any visit is considered an office visit. Now what you can do for those contact lens checks or those RX checks is exclude that encounter from the meaningful use reports. So you do have this checkbox for those contact lens checks to exclude it from meaningful use. Now in order to comply using MyVision Express, there are several ways that you can do it. So right now I'm in the HL7 CCD CCR subtab of the Health tab. I'm in the examination. And you can, of course, do this from the patient profile as well. So I have created the CCDA. One way that you can comply is by printing out the CCDA. So you can click on View, and you can print, and it'll count towards this measure. You can also click on Upload and send it to the patient portal. This is another way that you can comply. A third way is by clicking on the Decline button. So if you want to give this CCDA to the patient and they decline it, then you can click on Decline. It will actually also count towards that measure. Now the fourth way is by going to the Letters module and printing out an exam summary letter. So the Letters module is found in the Examination, and you'll just select any letter that contains the word exam summary. Now I have to stress, it must contain the word exam summary in it. You can call it exam summary meaningful use, exam summary long version, short version. As long as it has those two words, it will count. Now keep in mind that, for this, if you are going to be using the letters route, then make sure you are containing all the information that they are looking for. Now the information that they're looking for is the patient name, provider's name and office contact information, date and location of the visit, reason for the visit, current problem list, current medications, medication allergy lists, any procedures performed during the visit, immunizations or medications administered during the visit, vital signs taken during the visit, laboratory test results, list of diagnostic tests pending, clinical instructions, future appointments, referrals to other providers, future scheduled tests, demographic information. So you have sex, race, ethnicity, date of birth, preferred language, smoking status, care plan fields, including goals and instructions, and also recommended patient decision aids if applicable to the visit. Now, all of this information that they are asking for is found in that CCDA. So if you have attested to meaningful use prior to 2014, we always suggested the exam summary letter because it was more convenient. Now, if you can create a letter that has all this information, then wonderful. You can still use the letters module, and it will count towards it as long as it has those two words, exam summary. But now for 2014, my suggestion is the CCDA, because it's all in there already for you. You can just print it out, or you can send it to their patient portal if you want to save paper. Core number 9 is protect electronic health information. The objective is to protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. The measure is conduct or review a security risk analysis in accordance with the requirements under 45 CFR 164.308A1, including addressing the encryption, security of data stored in your certified EHR technology in accordance with requirements under 45 CFR 164.312A2 and 4, and 45 CFR 164.306D3, and implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process for EPs. There is no exclusion to this objective, so it is mandatory as it was in stage 1. Now, to comply with this objective, you can contact your local regional extension center. Now, each state does have their own regional extension center. You can email or call them to find out how much performing the risk analysis will cost and if they are able to do it for your office. The prices do vary depending on each center. The risk analysis document is also available through our Support Central page. This is an alternative to the Regional Extension Center. I would definitely carefully fill out the document and include any documentations needed to explain why a certain procedure or task was not done in your practice. The risk analysis will need to be provided if you are chosen during an audit. So this is one of those objectives that, don't just say yes to it and don't do it. You want to definitely make sure that you have the documentation to back up your yes claim to this objective. Core number 10 is clinical lab test results. The objective is to incorporate clinical lab test results into certified EHR technology as structured data. The measurement is more than 55% of all clinical lab test results ordered by the EP during the EHR reporting period whose results are either in a positive, negative, or numerical format or incorporated in the certified EHR technology as structured data. The exclusion is any EP who orders no lab tests whose results are either in a positive, negative, or numerical format during the EHR reporting period. In order to comply with this measurement, then you can select the Laboratory sub-tab in the Health tab. This is shared in the patient profile and the exam, and then you'll add the appropriate test type. So this is probably something that none of our providers or none of our customers will be using. So if you did a test to meaningful use using MyVision Express, those who did opt for this measurement and the menu measures, they also ended up taking the exclusion. So you can take the exclusion for this measure, and you can, if you do any labs, then you can enter the lab information here and also the results by just clicking on Add and filling in the appropriate information. Core number 11 is patient list. The objective is to generate lists of patients by specific conditions to use for quality improvement, reduction of disparities, research, or outreach. The measure is to generate at least one report listing patients of the EP with a specific condition. There is no exclusion to this, so it is mandatory. In order to comply, you're going to go to File, Reports, Patient, and Patient List. You're going to select an age range, so I'm going to select anyone from 1 to 40. You can also select a preferred contact date. You can do a date range, so we can do, let's say, the 1st of this year until today. And you're going to document a problem. You'll notice that these are all in the form of SNOMED codes, but you'll also see the translation to the ICD-9 code, and these are ICD-9 codes. So I'm going to choose diabetes, and I'm going to search for it. So it's going to generate this list of patients that contains the diagnosis of diabetes. So once you've generated this list, you're going to go ahead and click on Print. Core number 12 is preventative care. The objective is to use clinically relevant information to identify patients who should receive reminders for preventative follow-up care and send these patients the reminders per patient preference. The measure is more than 10% of all unique patients who have had 2 or more office visits with the EP within the 24 months before the beginning of the EHR reporting period were sent a reminder per patient preference when available. The exclusion is any EP who has had no office visits in the 24 months before the EHR reporting period. Just like clinical summaries, this exclusion will not count for you guys. So for this objective, it might be a little confusing. In total, there should be 3 exams for any patients that will count towards meaningful use for this objective. 2 of those exams must have been done in the past 24 months. From the start of the reporting period. The 3rd exam must be done during the reporting period. Now, that's your denominator. That's how the denominator is calculated. The numerator is going to be calculated, of course, with that 3rd exam and also setting your recalls. Now, to do that and to set that in MyVision Express, I'm in the patient profile, and first of all, you're going to set a preferred contact. So I'm going to show you 2 ways, either email or mail. These 2 are the only ones that are going to work for this objective. So if it is done through email, you're going to go to your letters module and you're going to pull up any letter that contains the word recall in it, and you're going to email it to them. That will count. If you are doing the preferred contact through mail, you're going to once again click on the letters module and you're going to print out any letter that contains the word recall. Now, core number 13 is patient-specific education resources. The objective is to use clinical relevant information from certified EHR technology to identify patient-specific education resources and provide those resources to the patient. The measure is patient-specific education resources identified by certified EHR technology are provided to patients for more than 10% of all unique patients with office visits seen by the EP during the EHR reporting period. The exclusion is any EP who has no office visits during the EHR reporting period. Now, to do education resources in MyVision Express, it is a little different now in 2014, the way that we're calculating education resources. Your denominator is going to be calculated by any procedure codes that's considered an office visit. Now, this is done in the assessment tab, and you'll just select your procedure. Now, how do you know which is an office visit? We do have a tool called a CQM data viewer, and this will let you know if that procedure code is considered a quote-unquote office visit. Just looking at it, I think all the procedure codes that you're going to be choosing would be considered an office visit. So, for example, if I start to type in 92004, when I search for it, then it's going to find that CPT code. So it's letting me know it's an office visit. So once you've selected that office visit code or any one of these 9 codes here, you're going to select it, close, and then you're going to go to education. Now that education is found over here, this checkbox. So you're going to check that off, and then you're going to select the appropriate education material. Now you can build up the education material here. You can also set the delivery, the source. This is all done during setup. So you'll select the appropriate education. It will indicate the education was provided. You'll run all or run the specific education material that you chose, and then you'll be able from there to print it. The patient can view it. You can talk about it with them, and then you'll just close out, and that will count towards that measure, or towards that objective. Core number 14 is medication reconciliation. The objective is the EP who receives a patient from another setting of care or provider of care or believes an encounter is relevant should perform medication reconciliation. The measure is the EP who performs medication reconciliation for more than 50% of transitions of care in which the patient is transitioned into the care of the EP. The exclusion is any EP who was not the recipient of any transitions of care during the EHR reporting period. So for those who typically don't receive any referrals or any transition of care, you can take that exclusion. Now to do this in MyVision Express, I'm going to show you 2 different scenarios. One is going to be for a new patient coming into your office. The second one is actually going to be for an existing patient. Starting with the new patient, in order to comply, you're going to enter their information, and you're going to go to the demographics tab, and you're going to enter the referral information here. Once you've entered that information, you're going to perform the exam, of course, and then you're going to go into the health tab. You're going to go into the medications, and if you do enter medications in here, then you're going to click, or even if they don't have medications, you're going to click on the reviewed button right over here. It will time and date that, and this will count for your numerator. Now for existing patients, you're going to create an exam, and you're going to go to HL7 CCD CCR, and for those who are being referred to your office, you're going to click on import, and you're going to import a CCDA from that outside physician. Once you have imported that information, you're going to go to the medications tab as you did with the new patient, and you're going to click on the reviewed button to record the date and time that the medication list was reviewed. Core number 15 is summary of care. The objective is the EP who transitions their patient to another setting of care or provider of care or refers their patient to another provider of care should provide summary care record for each transition of care or referral. Now the EP must satisfy both of the following measures in order to meet the objective. The first measure is the EP who transitions or refers their patient to another setting of care or provider of care provides a summary of care record for more than 50% of transitions of care and referrals. The second measure is the EP who transitions or refers their patient to another setting of care or provider of care provides a summary of care record for more than 10% of such transitions and referrals. Either A, electronically transmitted using CHRT to a recipient, or B, where the recipient receives the summary of care record via exchange facilitated by an organization that is a NWHIN exchange participant, or in a manner that is consistent with the governance mechanism ONC established for the NWHIN. The third measure is an EP must satisfy one of the following criteria. Conducts one or more successful electronic exchanges of summary of care document, as part of which is counted in Measure 2, with a recipient who has EHR technology that was designed by a different EHR technology developer than the sender's EHR technology certified. And conducts one or more successful tests with the CMS designated test EHR during the EHR reporting period. Now, the exclusion is any EP who transfers a patient to another setting or refers a patient to another provider less than 100 times during the EHR reporting period is excluded from all three measures. To comply with all three measures, to satisfy Measure 1, you're going to document in the Assessment tab of the exam you're referred to and your reason. For Measure 2, there are two ways that you can do this. You're going to go to HL7 CCD CCR. This is the sub-tab under the Health tab, once again in the patient profile as well. You're going to create a transition of care summary. You're going to click on this button and you're going to create that CCDA. And you'll see the type here is transition, and you can either upload it to the patient portal. Now, of course, that the patient must be signed up with patient portal as well. And this, of course, you can provide them that information. Once they've uploaded it, it will count, or you can click on view and you can print out the CCDA and provide it to the patient. In order to comply with the very last one, in order to comply with the very last measure, you're going to create that transition of care summary. Then you're going to click on upload. You're going to send that to patient portal. So you're going to log into patient portal. There is a patient portal for the practice. Now, keep in mind also that the patient must be signed up with patient portal in order for this to work. You're going to go to HL7 CDAs, and you're going to see all the patients who have a CDA uploaded. You're going to select that patient name. You're going to click on transmit, and you're going to send that to the provider. Remember that when you transfer the CCDA, the recipient does have to have a different EHR software. So anyone that you are going to be doing the electronic exchange, make sure that they don't have MyVision Express. It can be any Stage 2 certified EHR software. Core number 16 is Immunization Registries data submission. The objective is the capability to submit electronic data to immunization registries or immunization information systems except where prohibited and in accordance with applicable law and practice. The measure is successful ongoing submission of electronic immunization data from CHRT to an immunization registry or immunization information system for the entire EHR reporting period. There are several exclusions for this. The first one is any EP who meets one or more of the following criteria may be excluded from this objective. There are several exclusions to this. The first one is the EP does not administer any of the immunizations to any of the populations for which data is collected by their jurisdiction's immunization registry or immunization information system during the EHR reporting period. The EP operates in a jurisdiction for which no immunization registry or immunization information system is capable of accepting the specific standards required for certified electronic health record technology at the start of their EHR reporting period. The EP operates in a jurisdiction where no immunization registry or immunization information system provides information timely on capability to receive immunization data, or the EP operates in a jurisdiction which no immunization registry or immunization information system that is capable of accepting the specific standards required by certified electronic health records technology at the start of their EHR reporting period can enroll in additional EPs. In other words, you can take the exclusion for this objective since you're not going to do any immunizations. So I'm going to move on to the 17th core. The 17th core is using secure electronic messaging. This is a huge question that a lot of stage 1 customers had. How are we doing secure messaging? This is going to be done through the global portal. Once again, don't think of the web-hosted patient portal if you guys are web-hosted. There is actually one specific patient portal that was created only for stage 2, or only for meaningful use, I should say. Now, the objective, so in other words, this is available to both local, so server-based customers, and also web-hosted. Now, the objective is to use secure electronic messaging to communicate with patients on relevant health information. The measure is a secure message was sent using the electronic message function of certified electronic health records technology by more than 5% of unique patients or their authorized representatives seen by the EP during the EHR reporting period. The exclusion is any EP who has no office visits during the EHR reporting period, so this won't apply, or any EP who conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 3 Mbps broadband availability according to the latest information available from the FCC on the first day of the EHR reporting period. Now, in order to comply with this measure, going into My Vision Express, I'm in the patient profile, and you'll see that there's this new button on the top right that says Secure Messages. You're going to click on this button, and what it'll do, it's going to take you to the patient portal. And I have an example here of what it'll look like. So you'll go to Secure Messages. You'll see a tab here, and this is going to be done through the admin page, through the admin patient portal. And from here, I have a few examples here. You're just going to click New. You're going to select your recipients, the subject, and the body, and you can send it. And then you can, of course, receive messages from here. So the patient can send you messages as well from their patient portal, and you can receive it securely. So those are the 17 core objectives for Meaningful Use Stage 2. Now we're going to go into the menu set of objectives. Out of the 6 menu objectives that I'm going to be discussing, you do have to comply with 3 of them. The first one is syndromic surveillance data submission. The objective is capability to submit electronic syndromic surveillance data to public health agencies except where prohibited and in accordance with applicable law and practice. The measure is successful ongoing submission of electronic syndromic surveillance data from certified electronic health record technology to a public health agency for the entire EHR reporting period. The exclusion is any EP that meets one or more of the following criteria may be excluded. The first one is the EP is not in the category of providers that collect ambulatory syndromic surveillance information on their patients during the EHR reporting period. So this is something that you definitely want to look into so you can take the exclusion. The second one is the EP operates in a jurisdiction for which no public health agency is capable of receiving electronic syndromic surveillance data in the specific standards required by certified electronic health record technology at the start of their EHR reporting period. The third is the EP operates in a jurisdiction where no public health agency provides information timely on capability to receive syndromic surveillance data. And the fourth one is the EP operates in a jurisdiction for which no public health agency is capable of accepting the specific standards required by certified electronic health record technology at the start of their reporting period can enroll additional EPs. In order to submit electronic syndromic surveillance data, you're going to go to File, Reports, Patients, and Syndromic Surveillance. You're going to select your date range. So we'll just do, for example, the first of the year till now. And you're going to enter an ICD code. Let's do 36.41. And you're going to search. it'll go ahead and create that report for you. And you can click on Save As to save the data in the required HL7 format for CDC submission. Menu number 2 is Electronic Notes. The objective is to record electronic notes in patient records. The measure is to enter at least one electronic progress note created, edited, and signed by an EP for more than 30% of unique patients with at least one office visit during the EHR reporting period. The text of the electronic note must be text searchable and may contain drawings and other content. There is no exclusion to this objective. Now, in order to comply in My Vision Express, you're going to go to the Complaint tab, and you're going to go ahead and select the categories from the HPI Builder, and this will actually create your electronic note. Now, you can of course edit this by clicking on Unlock and editing the text in it, and you can sign it by clicking on the Sign button. It will sign the physician's name. Of course, they must be logged into My Vision Express and chosen as the physician, and it'll have their information here. You can also search for any context with the search box on the very top. So if I start to type in watching, it's going to say that it found that text in my complaint. Menu objective number 3 is imaging results. The objective is imaging results consisting of the image itself, and any explanation or other accompanying information are accessible through certified electronic health record technology. The measure is more than 10% of all tests whose result is one or more images ordered by the EP during the EHR reporting period are accessible through a certified electronic health record technology. The exclusion is any EP who orders less than 100 tests whose result is an image during the EHR reporting period, or any EP who has no access to electronic imaging results at the start of the EHR reporting period. In order to comply in My Vision Express, you're going to go into the Health tab, and the Health tab is found in the patient profile or the exam, and you're going to click on the Diagnostics tab. You're going to enter your information here, and under the results, you're going to add the result information, and you're going to click on the Attach button, and you're going to attach the corresponding image. Menu objective number 4 is Family Health History. The objective is to record patient family health history as structured data. The measure is more than 20% of all unique patients seen by the EP during the EHR reporting period have a structured data entry for one or more first-degree relatives. The exclusion is any EP who has no office visits during the EHR reporting period. In order to comply in My Vision Express, I'm in the Family tab of the examination. You're going to click on Add, and you're going to fill in the problem, the timeline, and the relationship to the patient. Now keep in mind, it must be first-degree relatives. If there are no known family history, then I'm just going to delete this. You're going to check off No Known Family History. Now, the last two measures may not be applicable for you guys. The 5th one is Report Cancer Cases. The objective is the capability to identify and report cancer cases to a public health central cancer registry, except where prohibited, and in accordance with applicable law and practice. The measure is successful ongoing submission of cancer case information from certified EHR technology to a public health central cancer registry for the entire EHR reporting period. There are several exclusions for this. Any EP that meets at least one of the following criteria may be excluded from this objective. The first one is the EP does not diagnose or directly treat cancer. The second one is the EP operates in a jurisdiction for which no public health agency is capable of receiving electronic cancer case information in the specific standards required for certified EHR technology at the beginning of their reporting period. The third is the EP operates in a jurisdiction where no PHA provides information timely on capability to receive electronic cancer case information, or the EP operates in a jurisdiction for which no public health agency that is capable of receiving electronic cancer case information in the specific standards required for certified EHR technology at the beginning of their EHR reporting period can enroll additional EPs. The 6th one is report specific cases. The objective is the capability to identify and report specific cases to a specialized registry other than cancer registry, except where prohibited and in accordance with applicable law and practice. The measure is successful ongoing submission for specific case information from a certified EHR technology to a specialized registry for the entire EHR reporting period. The exclusions that apply to this measurement is any EP that meets at least one of the following criteria may be excluded from this objective. 1. The EP does not diagnose or directly treat any disease associated with a specialized registry sponsored by a national specialty society for which the EP is eligible or the public health agencies in their jurisdiction. The second one is the EP operates in a jurisdiction which no specialized registry sponsored by a public health agency or by a national specialty society for which the EP is eligible is capable of receiving electronic specific case information in the specific standards required by certified EHR technology at the beginning of their EHR reporting period. The third one is the EP operates in a jurisdiction where no public health agency or national specialty society for which the EP is eligible provides information timely on capability to receive information into their specialized registries. Or the fourth one is the EP operates in a jurisdiction for which no specialized registry sponsored by a public health agency or by a national specialty society for which the EP is eligible that is capable of receiving electronic specific case information in the specific standards required by certified EHR technology at the end of their EHR reporting period can enroll additional EP. Now, if any of these two measurements do apply to you guys and you want to attest to those two or one of those two for the incentive or for meaningful use, then you can always use the reports in the syndromic surveillance. As I showed you before, you can always search for that diagnosis, and you can. So if you are going to be submitting such information, then you can use the syndrome surveillance report that I showed you before. Once again, I don't really think that these two measures really will apply, but if they do, then you can search for the ICD code. So there's, cancer of the eye or the eyelid. You can search for that diagnosis in your date range, and you can search for it. And you, as you could do with the syndromic surveillance, you can go ahead and save it and then submit it the way that you would for those agencies. So those are all of the objectives for Meaningful Use Stage 2. Now, a couple things that I do want to show you that we have added is if you go to the physician in-house setup, you can select a doctor and you can choose which stage you are on. So if you are currently in stage 2, or if you're going to be doing stage 2, in order for those reports to show up in the examination and also in the meaningful use report, then you'll just select the stage that you're going to be attesting to. That way it can calculate it. Also, if you click on meaningful use, let me actually select stage 2, you can select the objectives. You can select the objectives that you want to choose or that you want to do. Now, in your core, all of them are going to be checked off. In your menu items, you're going to select 3 of these. In your clinical quality measures, this is something that you do have to still report, although it is not a part of the meaningful use objectives, but this will calculate your clinical quality measures. You do need 6 of these. You do need 9 of these to report, versus in stage 1 you only needed to report 6, but it could be up to 9 depending if in those 3 core you got a 0 out of 0. Once again, clinical quality measures, they have no percentages tied to them as you saw in stage 1, but you'll just select the ones that apply. So there are a few that do apply to optometry. So there are some that may not apply, like appropriate treatment for children with upper respiratory infection. So you don't have to select those. There's other ones that do count. And in your settings, you can select which vital signs you are going to be taking. So if you are taking the exclusion for blood pressure but are taking height and weight, it'll calculate it here. And then you have your alternates for, well, the alternates will count for stage 1, so you can disregard those. So this is how you can set up the meaningful use per doctor. And then once again, once you go into the exam, you do have the meaningful use checklist that is here. So this will display depending which stage you're in, but if you select stage 2, it will show you the stage 2 objectives and how you did in this examination. So you'll see that it looks just the same as stage 1, but if you're new to MyVision Express and going directly into stage 2, just to talk a little more about this, you'll see once again all the objectives for stage 2, and you'll see in here which ones you've passed, which ones you did not pass. You'll notice the 0.01 here for some of these measures because it is looking at more than, for example, 50%, 80%, whichever measure you're on. So that's for within the exam. So the beauty of it is that while you're still in the exam, you can see how you did. If you need to correct it or add something, then you can go ahead and do so while you're still in the exam. Now the general report, which this is the report you're going to be using to attest, you're going to go to Files, Reports, and you're going to go to Meaningful Use. You're going to select the physician and your date range, and you're going to select the stage. So for this example, it'll be stage 2. All your cores are selected, your menu items. This is as per what was set up in the physician in-house, but you can always modify it on the fly if you need to. And clinical quality measures, and then your clinical quality measures. Once you've selected the appropriate information, you're going to click on Run. And it's going to run that report for you on the bottom. Now from here you have an attestation section and an exclude section. So each checkbox here will indicate that you're excluding yourself from that measure. So if I click on exclude, it'll ask if you've met the requirements to take the exclusion, and you'll notice that the report kind of cleans up a little nicely here. The attestation is for all those yes or no questions. So for this example, if I've already met my measure for my clinical decision support, so I did my 5, I can select yes, and then it cleans it up. Same thing applies with my drug interaction checks, since it's implemented by Dr. First. Now on the bottom you have your report types, so you can look at your automated measure calculations, which are your 17 core and your 3 menu objectives, and then you have clinical quality measures. So you have 2 reports available here. You have the export button, so you can go ahead and export that information, save it onto a file. You have the explanations button. So if something hasn't been done for a patient, this is a way to view from this report which patient it is. So you'll see here patient ID, also exam ID. So this is missing information. This will actually tell you how to correct that as well. Then of course you have your print button, so you can of course print this report. I would definitely recommend at the end of the reporting period to print it out and save it for your own records in case of audit. So that is it for Stage 2, Meaningful Use in MyVision Express 2014. Please visit our Support Central to view more tutorial videos and how-to guides in our knowledge base, and under support.myvisionexpress.com. Thank you for choosing MyVision Express to accelerate your practice.